are 8 causes of cirrhosis. Causes of cirrhosis include alcohol, viruses, drugs, autoimmune chronic hepatitis, biliary cirrhosis, chronic hepatic congestion, genetic disease, and cryptogenic. What are 4 genetic diseases known to cause cirrhosis? Genetic causes of cirrhosis include hemochromatosis, Wilson's disease, alpha-1 antitrypsin deficiency, and galactosemia. What secondary conditions can develop from liver failure? Liver failure can lead to elevated ammonia, hepatic encephalopathy, hypoglycemia, and impaired absorption of long-chain fatty acids. What are 5 common vitamins that are often deficient in the setting of liver disease? Vitamin deficiencies in liver disease often include folic acid, vitamin B6, thiamine, zinc, and sometimes vitamin D. What is the classic difference between the causes of micronodular cirrhosis and macronodular cirrhosis? Micronodular cirrhosis occurs secondary to chronic insults such as alcohol. Macronodular cirrhosis is usually secondary to acute insult. What is the most common cause of GI bleeding among patients with underlying liver disease? Esophageal varices are the most common cause of bleeding in people with liver disease and cirrhosis. What causes abdominal swelling in liver disease? Ascites is the most common cause of abdominal swelling in people with liver disease and cirrhosis. What causes gynecomastia, testicular atrophy, and decreased libido in liver disease? Altered estrogen and androgen metabolism causes gynecomastia, testicular atrophy, and decreased libido in liver disease and cirrhosis. What is a common cause of ecchymosis in the setting of liver disease? Decreased synthesis of clotting factors in the liver causes ecchymosis in the setting of liver disease and cirrhosis. What causes a decrease in red cells, white cells, and platelets in the setting of liver disease and cirrhosis? Splenomegaly and splenic sequestration causes a decrease in red cells, white cells, and platelets in the setting of liver disease and cirrhosis. What causes right upper quadrant pain in liver disease? Liver swelling causes right upper quadrant pain in liver disease and cirrhosis. What causes spider telangiectasis and palmar erythema in liver disease and cirrhosis? Altered estrogen and androgen metabolism with altered vascular physiology is the cause of these symptoms in liver disease and cirrhosis. What causes hypoglycemia in patients with underlying liver disease and cirrhosis? Decreased glycogen stores and decreased gluconeogenesis is the cause of hypoglycemia in patients with liver disease and cirrhosis. FlashMed, video flashcards.